breathlessness is a really complex symptom. About 39% of people with end-stage diseases of a variety of things, whether it's COPD, heart failure, cancers, any terminal illness, can experience breathlessness. And it's described as quite a distressing symptom for people. It can cause a lot of anxiety and a lot of discomfort and fatigue. And so it is a symptom that we really do like to manage well. We can all observe our residents. It can be a very simple thing by looking at somebody and assessing what their colour looks like. Are they pale? Are they red and flushed? Are they cyanose, so that blue-grey colour? We can move down from the skin and then looking into, do they have any distension in their jugular veins there? So any swelling or bulging that doesn't look how it normally looks for them. Moving down further, what is their breathing looking like? Does it look like hard work for them to breathe? Is the person pulling their shoulders up? What is their effort to speak? 1 word, 3-word sentences, or can they say 7 or more words? We then move down the body and have a look. Is the abdomen swollen with fluid? Is there swelling in the feet or hands? We also need to look at people's level of consciousness. We may notice that they are confused or irritable. The most important thing we can do as healthcare workers and people supporting residents who are breathless is to remain calm ourselves. A simple thing we can do from the very outset of this conversation is to gently put our hand onto the shoulder of the resident. That often then lowers their shoulders for them immediately without us saying anything. The next thing that we can ask the resident to do is focus their eyes on a rectangle. And as they're breathing in and out, trace their eyes around the edges of the rectangle. Take a breath in through their nose if they can, on the short side of the rectangle, and gently exhale on the long side. When they exhale along that long side of the rectangle, we ask them to purse their lips. We know that cool air on the face reduces breathlessness for most people, but what we don't want is this sort of fan that I call my menopause fan. It goes everywhere with me. This type of fan, although it's great for menopause, it means that I'm using muscles in my arm and wrist, and I need to be able to coordinate that. So they're not ideal for people who are perhaps already feeling fatigued from breathlessness. These fans, which are handheld, portable and battery operated, are the fans that we recommend for reducing the sensation of breathlessness in residents. These ones are super easy to use, and as you can see, the blades are very soft, and so if the person gets distracted, they won't sustain a skin tear, injure themselves. So we ask the resident to just direct the fan at the lower part of their face, and that feeling of breathlessness will reduce for them. With everything we do, it's really important that we also document all of these interactions. And so whether that be through a breathlessness action plan, because then we can refer to it to know what usually works well for this resident. But we want to sort of be able to very quickly find what tends to work well for this person, what doesn't work well for them. If we can do that and support the resident to do some of these strategies for themselves, or we can be on hand to guide them through it, then we're going to have a resident that trusts us more and is overall more comfortable more quickly.